This is John from All Points TV, and today we are sitting down talking to Laurel Federbush. And if you're a regular viewer of All Points TV and previously Flint Talk Radio, you know who Laurel Federbush is. She's a harpist out of Ann Arbor. She's also an author and kind of the Renaissance woman, I guess. But anyway, we're coming here today to talk about something that actually I was very glad that she actually contacted me, and we're talking about it, and she was very willing to come in and talk about. She just recently, in December, wasn't it?
Yes, December.
Underwent a colostomy. And there's many reasons, and it's like people have colostomies, and some are cancers. Some people are like they have some kind of physical injury done to their intestines and stuff like that, and requires the colostomy. Sometimes it's a form of cancer. Sometimes it could be a gunshot victim. It could be somebody from some kind of traumatic accident, and somebody, something happened to their intestines, and they have to do this. Laurel's, yours occurred because of. Would you want to go into that?
Oh well, they don't know for sure, but my doctor's best estimate of what caused it was that my uterus became enlarged because of fibroids, and the uterus is right below the colon or large intestine, and the uterus, when it became enlarged, it started pressing against the colon, and so the colon was kind of constricted a little bit, and waste material started accumulating there. Like a lot of the waste passed through. Like I didn't know that there was anything wrong with my digestive tract. I mean, I had been taking with a Prilosec or omeprazole for a while because of some stomach things, but I didn't know that there was any kind of a blockage anywhere. But it turned out that there was, because some of the waste passed through, but not all of it apparently. So the stuff that didn't pass through accumulated in my colon, and it became a very hard ball, and it scraped against the sides, and eventually it tore the side of the colon. It tore a hole that was like several inches long, and they don't know how long this had been going on for. But anyway, it was an emergency situation when my mother insisted I go to the hospital. And I actually didn't know that I was gravely ill, or I didn't realize that there was this grave situation. I thought that I had the flu or a fever. Like I had some very serious abdominal discomfort, but it didn't seem to me different from some other stomach flu type things I had. So I was throwing up clear liquid, and but I just thought that it was a more common everyday kind of illness. So, but when they took me to the hospital, they found that they did a CAT scan on me. They took me to the emergency room. My mom called my dad, and they took me to the U of M emergency room, and they were very quick at diagnosing the problem. I think it was within minutes of me entering the emergency room that they did a CAT scan and found that there was this hole in my colon, and they knew right away what to do about it. So it was a very quick process.
Yeah, because as many people know, like an appendicitis, and if they get a severe case and actually the appendix will burst, that'll cause you die of infection. So that definitely could I can see there's a possibility occurring on this too as well, right?
Right. Yeah. And apparently my blood pressure was I guess dangerously low. They asked me if I took any blood pressure medications, for low blood pressure, and it turned out that my blood pressure had lately been more on the high side, so that was kind of surprising to me. But at that point, my blood pressure was very low.
I'm going to go into this, and this is not the pleasant part. And when I was a kid, nobody wanted to talk about it, but everybody made reference. The stomach, passing gas, stools, all that stuff is considered a source of amusement. They call it scatological humor, but it's something very severe.
Right.
It's something very significant. The waste removal from the human body is so crucial, and it's almost like everybody's so ashamed to admit that this goes on.
Right.
So I'm going to ask you a question. So if it's kind of embarrassing, just tell me. I'm sorry, but I have to know. So you didn't feel like you didn't notice that you're having a change in the number of bowel movements or anything? Or?
No, and actually I haven't actually read very much about this kind of thing compared to, like you'd think I'd be reading about it all the time, but actually I still haven't read that much on it yet. But from what I have read, it seems like most of the people who have been operated on for similar things had problems with constipation. and that was actually not a problem that I had. I think there was like maybe 1 or 2 times in my life when I remembered being constipated. One of them was when I traveled to Japan and I had bad jet lag, and that caused it. But ordinarily, that's not a problem that I ever had. So, so if I were, if you're someone who hasn't experienced that particular symptom, it doesn't mean that you still might have these other problems. But yeah, and I guess everyone's situation is so unique. But yeah, I did not realize that. Like when the doctor first told me that the problem could have been caused by hard stools, I thought, well, what hard stools? Like I never saw any come out of me or anything like that. It didn't seem like that was a problem that I ever had any problems with.
Okay. Now I just don't know. Now you have a colostomy. You had what they call stoma put in.
Yeah.
Created.
Well, created.
I'll show a picture of that.
Okay.
We got a picture. This is not of Laurel. This is a picture that was right off the internet. So
yeah, actually, my stoma is a little bit higher. It's higher than the one that they showed the picture. So I guess different people, depending on their situation, have it in slightly different locations. Like mine is above the belly button area, and there's the one in the picture is below that.
And I'm showing a picture too of it where it's like more of a mock-up of the human body where they have basically exposed the intestines and shows you where it goes on what they're talking about. So you'll see to the right. You won't be able to see it because you can't see the monitor, but it shows where they do the incision, and then they create this. Basically, it looks like from the appearance of this, it looks part of the intestine is projecting outside the abdomen, right?
Yeah, that's what it is. Like I guess it says, ostomy is a surgically created opening of the body for the discharge of waste, and the stoma is the end of the colon, or it could be the ureter, I guess. It could be, or part of the bowel, depending on what kind of procedure you have done. But in my case, it's part of the large intestine that's protruding through the hole.
Yeah, it's like, basically, and I'll show this other picture here of what it looks like. Basically, you saw the picture I showed about the person with the stoma, and they're placing like a bag.
Mm-hmm,
right. And basically, I hate to use an analogy, but it looks like a lot of bags used for vacuum cleaners. I mean, it's in a similar fashion.
I guess so.
Sometimes you have that tube comes in and it pulls the material you're bringing up off the carpeting into a tube where the bag is at, to the tank, mm-hmm. And that looks similar to that. And now, it's like this is like kind of a squeamish thing for a lot of people, I think. But I mean, the bag, do you reuse bags? Do you have to just toss them out? What do you do with them?
You put on the bag and you keep it on for 3 or 4 days, and then you take it off and put on a new bag and throw that one away.
No, it's like this is an adjustment. I mean, it's like you're a healthy individual and you didn't know this was going on, and you always thought you were pretty healthy, and then this has happened. I mean, and thank God they found it, because I mean, if the intestines burst, I mean, it caused. But I think it's peritonitis. Don't quote me, but I think that's usually it's associated with it. Mm-hmm. It's an infection associated with the intestinal tract, and what happens when it's ruptured, like the appendix even, and that's a severe, I mean, very fatal, often fatal, infection. Right. So I mean, you actually staved that off, thank God. But now, what about the adjustment period to this? What did you go kind of emotionally? Did you go through? Was this kind of like was it like a shock to the system? What went on with you?
Well, see, one of the reasons that I wanted to appear on this show is to let people know that living with a bag like this actually isn't, it isn't actually a bad thing, which is, I'm sure most people would think this is a horrible thing. Even, before this had happened to me, I had heard one time about someone having a bag like this, and it sounded horrible to me too. So, I mean, I don't blame anyone who thinks this is a horrible way of life. But actually, to me, the bag is sort of nothing. Like everything else, there were other things about this whole process that were very difficult. Going to the hospital to begin with, like I was, I felt really horrible. I was in physically very uncomfortable situation, and the whole healing process after the operation. The operation, thank God, went smoothly, and it was very quick. But the whole recovery process was kind of difficult. and your body doesn't function normally for a very long time after the operation, even though I recovered very quickly from what I hear compared to a lot of people. But like for over a month after the operation, I couldn't really eat normally. Like eating wasn't a pleasurable thing. It always had caused me gas, discomfort, and like I didn't throw up my food or anything, but just wasn't fun to eat. And I didn't know if I would ever get back to normal eating. One of the doctors, when I was telling her about my problems, wasn't sure that it ever would get to be a normal thing again. And because eating such a pleasurable part of life, ordinarily that was kind of sad to me. So like that took a long time, and just your physical strength. I was, for a long time very, low energy after the operation, and I had some pain, discomfort in my insides still, just from the operation. They're still not totally back to normal. Like they usually don't hurt, but if I do. If I try to dance around or do any, jumping kinds of things, I would get pain in my insides, like not severe pain, but, just your body takes a long time to heal. So that was difficult, just being out of your usual routine. And one of the things that was actually one of the most difficult things was the antibiotic regimen I had to be on. Because I had never been through surgery before, so I didn't know that this was the way they would do things. But after I left the hospital, I had to take antibiotics 3 times a day, and it wasn't just like antibiotic pills. Like I'd been on antibiotic pills before, but this was something where I had to do this myself. I had to learn how to do it myself. But you set up a bag of the medicine, and it drips through a tube, and it goes into something in your upper arm called a PICC, P-I-C-C, and learning how to do that whole thing was actually very difficult to me, in a way that was kind of one of the worst things about it.
It's actually, I had to go through that to help my mom.
Did you really? Okay.
My mom had a PICC line put in because she had she was a diabetic. She had a bone infection set up because she broke her foot. They broke her toe, and they set the toe with a pin at the hospital. But she was a diabetic, and they didn't take all the necessary precautions. Well, the podiatrist he's way beyond being just a podiatrist, but he had to help combat this infection. And one of the ways was doing the PICC line and the antibiotics through the bag that you're talking, the IV bag. She had to do like 2 or 3 times a day, like you're saying. And I think she was on Cipro, what they used. And the PICC line actually allows people. It's a huge amount of antibiotic. Then that's what it is. Of course, that varies according to what kind of the antibiotics have varied according to where they're fighting the infection, what the kind of infection they're fighting. So that's there's also some broad spectrum ones, and I think Cipro is one of them.
Yeah,
very
that wasn't
strong
the one I was on, but yeah, I guess it's the same kind of thing, right?
And you got to basically inject into the line after you. It's what they call the acronym of SASH.
That's
saline,
right. Yeah.
Saline. Then you put the antibiotic in. Then you pull that when that's ran its course and through your system. Then you pull that out, and you actually have to inject in the line that stays on your arm all the time. Mm-hmm. They tape it next to you so you could keep it. So you can just basically plug that the next IV back into it.
Yeah, I'm glad you explained that. I wouldn't have been able to explain it that well.
Then you have to clean it again with saline, and then put heparin and shoot heparin into it.
That's right. Yeah.
So they could keep that vein they're into not clotted. The blood doesn't clot. But heparin is a anticoagulant. So when they did this for my mom, I had to wash my hands, sterilize my hands, put them in gloves. Had to have a mask put on, and I actually, once I started, I couldn't stop. I couldn't do this. It was like, and I also had to worry about bubbles in the antibiotic bag and stuff like that. And it was a pretty complicated thing. So you did have an ordeal.
So you did it for your mom.
Yeah.
She didn't do it for herself.
Right. Yeah. And so you did it for yourself. So
yeah, and it's very complicated to learn. And I mean, maybe some people wouldn't find it that difficult, but I have no medical training, no medical experience, and I'm not very. I don't think I'm very good with my hands or good at learning new. Like if someone gives me a set of very detailed directions for how to do something, I get kind of overwhelmed by it, and I got overwhelmed by this. And when the nurse at the hospital was first showing me what I was going to have to do when I went home, I sort of panicked. I thought there's no way I would be able to learn how to do it. That's just outside of my skill set. And even the nurse that was showing me once I went home, they for a long time afterwards, for a few weeks afterwards, they had me do this home health care with nurses would come to my house, and the first nurse that was one of the nurses showing me how to do it. I felt like she was scolding me because I wasn't doing something right. That might not have been her intention at all, but I got very defensive and uptight about it. And then the first time when I was trying to do it myself, that night, after, when there was no one else there to help me, even though I'd written things down, she had written down most of it, but I forgot how to take off one of the parts of this thing. And I was sort of panicking, and I called the 24-hour line, phone number they gave me. And there was a woman on the phone who was very patient and eventually did manage to help me. But that was a long process, too, because I didn't know all the medical terminology for the different parts of the mechanism. And I didn't know how to describe it. And I guess different patients have different systems they're using, so she couldn't, like if I said it's the blue thing or something, she wouldn't know what the blue thing was. But anyway, eventually she figured out what to tell me, and I succeeded in doing it. And then after that, I did finally learn how to do this. So even if you're going through something like this, if it feels overwhelming at first, you do eventually learn how to do it. And I got to, it was sort of a love-hate thing, but I got to kind of like this thing because, I felt a sense of mastery because I had actually learned how to do it myself, and it was a difficult thing, and I learned how to do it, and it was saving my life. And it gave me something to focus on besides feeling scared or feeling sorry for myself or wondering what's going to happen to me. It gave me something very definite to focus on. So in that way, it was a good thing.
Now the site that they, and that picture, I'll put it back up again because you're gesturing. I don't want you to, okay, where they have that sticking out of your abdomen, that looks like a flesh. It's flesh, right? That's not like a plastic tube or anything. That's flesh. Do you have any? Is there any kind of care, special care given to the actual part of the intestine that looks like it's projecting outward?
No, you think that there would be, but no. Basically, you wipe it off a little bit, like when you're changing your bag. There's for a few minutes that thing is exposed, and you wipe it off. But you just wipe it off with water and a cloth or tissue or something. You don't use any special chemicals on it or anything. You just wipe it off. But you're actually not supposed to touch it more than you have to. You don't want to irritate it or something. So you basically leave it alone as much as you can. So
now, okay, I got to ask: are there certain foods you still got to avoid, or you can pretty much consume anything? Or
that's another thing I want to bring up. But if you read the literature about this, you'll see that there are certain foods you're supposed to avoid, but it really depends on your individual situation. At my last doctor's exam, she said that I could basically eat whatever I wanted. That the restrictions, some of the restrictions that's listed, don't apply to me. They might apply to people with some other conditions, but not to my case. She also said that some of the literature is outdated, maybe theories they thought of at first that you're not supposed to eat such and such, but then later decided that was okay. And depending on, there might be some things that would give me more or less gas, but there's nothing that would be dangerous for me to eat. Like the materials you see often say, that some things would actually pose a real danger, like they could block your stoma, and then that would be a medical emergency. So that was, scary to read that. So I was, very trying very hard to avoid certain foods. But she said that, in my situation at least, that there are no dietary restrictions. I think I lost a lot of weight as a result of this. I lost 25 pounds. When I was in the hospital for a week or so, I couldn't eat anything, after the procedure. And I guess they fed me intravenously. But other than that, for a whole week, I had no food. And then after that, like I was saying, eating was uncomfortable, and they like I kept saying, should I be on a liquid diet, because it didn't seem like my system liked any of these solid foods. But they said no, as long as I was keeping it down, I should eat solid foods, but on a trial basis, like see what works for me. So like I can't eat as much food as I did before. Like I have to eat somewhat smaller portions. I don't know if that's because my stomach shrank from this, or if my insides are configured differently, or what. But in my case, that's not a bad thing. Like I think eating smaller portions might be better for me.
No, yeah, there's a lot of things like that. I was thinking about the dietary maybe restrictions or anything that might be a possibility, and I think it might. You're right. It might be because some people might have had more of a condition to to the stomach that it could cause the to become infected or something like that. So yours seems like to be different. Another thing is I was going to ask. Maybe I don't know if you can answer this, but I'm under understanding of a digestion. Certain things will occur in the colon and stuff like that, in the intestines, like absorption of certain nutrients and stuff. Now, is this impaired because of this? Like, basically, it's like a bypassing, and
right.
And is there a potential for that to cause you not to be able to absorb certain nutrients or something like that?
Yeah, I think probably you don't absorb certain things, as well as you used to, or maybe some things not at all. Let's say I was asking that's something I don't think we talked about yet, that this procedure in many people is reversed after a certain amount of time. Like you have it done, and then once your insides heal to, like after a year or so, you can have it reversed. And I was asking about the health benefits of having it reversed or not reversed. I asked if it was, if your lifespan would be shortened because if you didn't have it reversed, and the doctor said no. So I don't know if I don't know if that means that maybe not being able to absorb all of the food, maybe it's not really a. I don't know. I don't really know.
Okay. No, I'm sorry if the talk upsets you. I mean, it's just, but it's because this is something. It is your body, and it's also your potential for losing your life, and that had to be a shock. I mean, I don't even like going to a doctor for blood pressure checkups, okay, and stuff. I don't even like going to doctors, and it's not because the doctors are bad or anything. I just like the thought of being sick.
Right.
I don't like being sick. I don't like having anything wrong with me. And now this is it seems like you have a pretty decently adjusted to this. I mean, of course, I'm sure there are times when you actually probably have issues with it, or you do you feel like you're like, like you're, you met a bad, something happened and I don't know how to word it, but basically you say, why me? Did you ever have that happen to you or anything? Or?
Actually, not so much. I think I feel sorry for myself more often in trivial situations than I did in this case. I'm not sure what the difference is, but like on the day-to-day level, there might be things that come up like, why me? Like if maybe someone talked nastily to me, or if I didn't make as much money as I thought I should, or some trivial things like that come up, I'd be more likely to think, why me? But whereas in this situation, somehow that wasn't one of the things that I particularly experienced. So, but you were talking about feeling not liking to go to the hospital, and I was actually, and before this happened, I had to go to the hospitals to. My mother had some heart procedures, and I had to sometimes go to the hospital for her with that, or she fell down and had a black eye, and we had to go to the hospital for that. But in the process of going to the hospital with with my mother, and it was. I don't think I was very good at hospitals. Like there was something about it, like maybe on some primal level, I just, I don't want to be here. This, you have sort of a natural aversion to it, and the hospital situations were kind of stressful for me, and I think in some situations I would sort of lose my temper with some of the medical people there, not because they had done anything wrong, but because I just wasn't comfortable with the whole situation of being in the hospital. And I sort of, my mom has to take all these pills, and you start wondering, gee, well, does she have to really be on all these pills? What are they doing to her? Like, maybe doctors, maybe the whole medical thing isn't a good system. Like, I was on the verge of being very anti-doctor and anti-hospital, just because of my own discomfort with it. And but I think now, as a result of them, really saving my life, I think I'm much more, pro doctor. I'm really grateful to the medical people, who are so competent and so patient, and did all these things for me. So.
No, well, anyway, I'd like to, thank you for coming in and talk about this, and I'd like to do a follow up or anything, and maybe later we could talk about it. Are there support groups out there that you know of for people who want to?
Yeah, there are. I just want to say, this really isn't hard to get used to. It's you'd think that having a bag like this might be the worst thing in the world, but it's not. And I really like my bag, which might sound hard to believe, but it sort of reminds me that I'm glad to be alive. And, when I change my bag, it's a chance for me to focus on myself and my own needs, and, to really take care of myself. So I think it puts things in perspective for me. And I think in some ways my life has been enriched by having this. So I want to encourage anyone out there to, to see this in a positive light. If you have to have this done, or if you know someone who is, might have to have this done, it's not a bad thing. And there are support groups. Well, there's some Facebook support groups you can join, and also I know the University of Michigan Hospital has a support group. I haven't been able to attend yet because of my schedule, but they have one, and I'm sure other area hospitals have them. So you can look into all of those things.
Well, thank you again, and thank you very much for opening yourself up and be vulnerable to talk about this procedure and how it affects your life. Thank you very much.
Thank you for having me.